of course, Dr. Bailey, before we had our first commercial break, we promised that we would talk about the impact that recent developments in Nashville, primarily economic developments, expansion, et cetera, some of these developments have had on what you do as the director of the Metropolitan Health Department. Let's do it from that perspective.
Well, whenever you build new things, you know, in the city, you know, they are subject to codes and subject to our looking into whether there's appropriate runoff for sewage and the engineering as far as the groundwork is concerned. We're in there doing the restaurant inspections and making sure we were involved when, especially with the stadium and the water, the sanitation with the facilities not adequately functioning. So there are a lot of peripheral things that we're involved in. Just buildings in general, air quality, indoor air quality, and general sanitation issues. So not as tremendously involved. Those are regulatory things that we do, and we do them throughout the city on an everyday basis.
And of course, that has had just a sort of a minimal impact, because these things would have to be done by folks who are already assigned and already organized to do those kinds of things.
In the sense that they're done without new staff. I mean, the more buildings you put up, they still have to be inspected. The staff, our staff has pretty much stayed the same over the last few years. There have been no additions. But we still find a way to be efficient with what we do and tend to those things that are very critical, you know, to the health of the community.
Well, now, what do you consider to be the major health concerns as we move into this 21st century? And what are some of the things that you are prepared to deal with at the Metropolitan Health Department?
There are at least, let's see, 3 or 4 things that come immediately to mind. Communicable disease control is always a big issue, and it's going to be a big issue as we go through this millennium. Not so much that we're having a lot pop up, as much as we have to maintain that surveillance so it doesn't pop up. At any moment, we're liable to have an outbreak of anything, but there are public health protection factors in place that the public doesn't see on an everyday basis. How many times we go out and inspect restaurants, for instance, or how many times we quarantine someone or prevent someone from going on to disease because they're a contact to another disease entity. Right now we find ourselves with a high number of syphilis, and the potential for that to get out of control is there. And about, about 11 months ago or so, we started on this community-wide effort to decrease and even eliminate syphilis. So communicable diseases is something that is a major focus of the health department. The other biggie would be disparities, the disparity gap. Across the nation, as well as in Nashville, you find that blacks are dying 2 to 3 times, and in some indicators as much as 4 times more quickly or earlier than whites. And this has been a focus of the Surgeon General to address. They apportion dollars to about 32 cities to particularly address it, and we were one of the cities. So we have made that a major focus, particularly in the areas of hypertension and diabetes. Only 8% of people know that they have diabetes. In blacks, only 4% in whites. And we know that that is underreported because most people don't know that they have it. And even with 8% knowing and 4%, that's a big two times difference. The number of years per life loss, the number of deaths is just astronomical. Hypertension, stroke, the same thing. There are a lot of risk factors with just those 2 disease entities that cut across each other, that if we can get a handle on exercise, diet, obesity, whether you smoke or not, those type of factors, then you can make a big dent in those. So that's a major focus because there is a gap, and that gap can be closed. You look at youth, and I put all youth together, not just those at high risk or those not at high risk, or those who live over here, or those who don't live over or live somewhere else. But there has to be a focus of this community on youth because that's where our earliest and primary prevention can happen. If we want to impact things that traditionally happen in high school age, where kids begin to experiment and test and feeling like nothing can happen to them, that's when most of your teenage pregnancies occur, crimes, drug usage, and the consequences of that begin to happen, so that we have a dropout rate. That needs to be all of our concerns, not just schools, not just social services, not just police, but it should be all of our concern. So what do we need to do to change? What do we need to change in our approach that will make a difference 1, 2, 3 generations out? That stretches our vision further than one council session or one mayoral session. We have to think in terms of how I want to leave this city for my grandchildren. You know, so it's challenging to see, and there are several tools out there, and there are some good collaborative process with us, schools, police, juvenile court, parks, social services, sheriff's department, that are trying to address that very thing. What needs to be in place to identify kids early enough and to produce the kind of results you want? How do we bring out the best in our kids to make them successful? So it takes all of us, and there's a lot of community collaboration around these kind of issues.
And so the health department is really not only concerned about the physical and the mental health, but it's also concerned about prevention, and by being so, working with the various other agencies in order to meet this. And of course, I think one of the problems, as we enter about 15 to 20 seconds left in this segment, I think one of the problems that you've already alluded to, Dr. Bailey, is the problem that drugs have caused within our society. And so when we come back during this final segment, we want to talk about the impact that it has had upon the health of Nashvillians. And of course, we'll be back with our